This has happened so many times before. When you start seeing those measles vaccinations drop, and it got to a threshold this past year, which really puts us at risk, the majority of states now have measles cases. And there's actually a math formula for this. Based on the infectiousness of a virus, you know what that number is. And for measles, it's around 94 to 95%. But when most of the country's below 95, well, this is exactly what happened. So it's entirely predictable that this would happen, and then it happened.
Educate, inform, inspire. The Dan Parsons Show, a podcast that lifts up instead of tearing down.
Hey, thanks for tuning in to the Dan Parsons Show. I'm your host, Dan Parsons. As we start a new month of programming, I wanted to take a moment and thank you for the tremendous response we've received these past few weeks. We continue to hit new records on the number of viewers and listeners. So thank you very much. Okay. On to today's show with physician Dr. Bob Rauner about the first case of measles in Nebraska in nearly a decade. Enjoy. Well, and it is my pleasure to welcome Dr. Bob Rauner to the Dan Parsons Show. Dr. Rauner, welcome to the Dan Parsons Show.
Thanks. Happy to be here.
Yeah, Dr. Rauner is the president at the Partnership for Healthy Lincoln. And he also serves as president of your Lincoln Public School Board. So, Bob, it seemed timely for us to get on the mic and talk about what's going on with measles here in Nebraska, because I know, well, let me back up and just thank you for something. Before we dive into this, I'm not even following my own script. You recently relaunched your very popular YouTube series discussing health issues in the state. And I just wanted to tell you, I know I speak for a lot of people, that that's a much needed voice here in Nebraska, a calm, professional, medical, and fact-based information. So on behalf of a grateful audience, thanks for what you do online.
Oh, you're welcome.
I mean, that's I think it's a service that needs to be continued to, and I know you get a lot of great feedback. You've got a lot of people following you. So as you've relaunched your series, you began following the growing measles outbreak in Texas, and at an LPS board meeting back in April, you warned, quote, Nebraska's vaccination rates mirror those of Texas. And we have similar holes, just like Texas does, you said. Mm-hmm. And you said it's likely only a matter of time before measles spreads to Nebraska. And your prophetic voice was unfortunately correct. And sure enough, just last week, Nebraska confirmed its first measles case since 2017. So help us out, Bob. Where are we going? Let's talk about this.
Yeah. Well, I mean, the frustrating thing from my perspective, this is basically a math problem. We know how this works. The problem in the United States is frequently put people in charge of public health who may not understand the math of public health. And so, and this has happened so many times before. When you start seeing those measles vaccinations drop, it's concerning to all of us, of course, as we saw it. And then it got to a threshold this past year, which really puts us at risk. And sure enough, we regularly get measles imported from other countries because someone's traveling. They go to a place where there's measles and they bring it back. But you'd have a few cases that it would fizzle out fast because we had really good vaccination rates in the United States, especially Nebraska. But when those imported cases, they don't stop now. And that's the problem. We fell below a threshold that prevents that. And so the Texas outbreak has just continued to grow and grow and grow. And so the majority of states now have measles cases. Not all of them are tied back to Texas. Some of them are from other imported cases that have also continued to spread, because this is exactly what happens when measles or vaccination rates fall below a certain threshold. And there's actually a math formula for this. Based on the infectiousness of a virus, you know what that number is. So whether it's polio or pertussis or measles, we know what that number is. And for measles, it's around 94 to 95%. So it's always shot for more than 95%. But when most of the country's below 95, well, this is exactly what happens. So it's one of those things that's entirely predictable that this would happen, and then it happens. So we had months to prepare, but I think we're finally starting to get some people to pay attention.
You were quoted in Emily Wolf's story, reporter for Nebraska's very first nonprofit newsroom, Flatwater Free Press. And Emily wrote about the analysis. They did an analysis, as Flatwater often does, digs into the numbers, and they looked at Nebraska's childhood vaccination rates, and they're declining even as the threat of measles emerges. And driving that decline, Flatwater wrote, is the exemption enshrined in state law about religious freedom. And so they found that statewide, parents are opting out of routine vaccines like the ones targeting, as you said, measles and chicken pox and other diseases with more regularity. So how have you observed that? And what can we do to help reverse that?
Yeah, well, the challenge, there's three types of exemptions, and each state has its own exemptions, for example. Some states only allow a medical exemption, like, say, West Virginia, for example. And that's why West Virginia's vaccination rates for measles are 97, 98%. They're much higher because they don't have either a religious or a philosophical exemption. Nebraska does not have the philosophical, they have the religious exemption. However, I would argue that in effect, we also have a philosophical because there's not really any follow-up. And I think Emily talked about it in her story. You can just basically sign a form and say, I don't believe this, and get it notarized. There's not much to it. Whereas in other states that you claim a religious exemption, you have to actually explain what that religious exemption is. Because it turns out the vast majority of our religions are not against measles vaccination. So let's say, for example, you're a Catholic or a Lutheran, and I've been both in my life. Neither the Catholic or Lutheran Church says you shouldn't get vaccinated against measles. So can you claim a religious exemption if you're a Lutheran or a Catholic? Some places will ask you have to say that I'm either a Lutheran or a Catholic, and here is the doctrine that says I'm exempt. We don't have that. It's simply all you have to do is say it's against my sincerely held religious beliefs, sign it, notarize it, there you go. So maybe one of our problems is it's too easy, and I actually think it's not really a religious exemption, it's more of a philosophical, but they're using the religious exemption to do it because it's too easy.
Well, and let's face it, after COVID, I would argue that philosophical mantra is really a political mantra. And so it's become, quite common for people for political reasons, to be against a lot of these scientific facts. And so therefore fewer people are getting vaccinated, and here we go down this slippery slope.
Mm-hmm. Yeah.
And so I know for you from a public school perspective, this is really important to the work that you're doing as an elected official. And we're so fortunate to have your fact-based medical advice to the public school system. And but is that voice helping?
I think so. And I think obviously I'm a little biased here. I think Lincoln Public Schools has some very good staff and very good management and does things pretty well. And that's why one of the reasons why Lincoln Public Schools has all of its schools above 95%. So when that data came out, we started looking at it. We have our head of school nursing, Wendy Rau, worked with our health department. They analyzed every school. They put out a message to all parents explaining to them what was happening, what the risk was, also pointing out to them that if you are not vaccinated and you're exposed, your child has to sit home for 3 weeks. And that's obviously a problem for working parents. Mm-hmm. And there was response. So actually now all of our LPS schools are above 95%, which is great. So it shouldn't spread within our schools because we're at that nice threshold. Now the question is, what about the rest of the community and other parts of the state? So, the other thing to keep in mind that those rates that Flatwater got from the state, those are from the fall. And they're better than that now, because what happens when the kids come to school in August, September, they may just be missing documentation, or they were behind and the school says, hey, please get your vaccine. Not everybody claims the exemption. Some go, oops, I missed one. Then they go get the vaccine. And so the numbers get better as the schools goes through. The question is next year, when the next round of kindergartners come, have they been vaccinated? Because the school has no way to contact them because they're not in our school system yet. So then you got to rely on public health messaging, physicians' offices, things like that. which is also happening right now, which is a good thing, especially in Nebraska.
Yeah, the story by Flatwater, and again, maybe we should talk about this case. Sheridan County, I believe, is where this case originated from. And so, any thoughts on how the rest of the state is doing compared to eastern part of the state?
Well, as the note said, it's spotty. It's actually not just west. So Lincoln was one of the lower rates last fall. I think we've made a difference by that. We don't know how much because there's not a reporting mechanism to say how much we've gone up. But the other lowest area other than Lincoln was western Nebraska and the Sandhills. So if you were going to say where would it start first, you'd pick one of those areas if you were betting, and that would be a good bet because that's exactly where it started. The child from the last I read, it's a child who had one of the two shots, hadn't had the second shot yet because they weren't old enough, and may have had some health conditions that made them immunocompromised. So it put them at a little higher risk, but had no travel history. So if they had no travel history, they were exposed by somebody else in the state that had measles, which means, or someone passing through, which may have been the case actually. So, but that means other people were also exposed. And, if the vaccination rate was 90%, then 10% of those people that person ran into will be developing measles over the following 3 weeks. So likely it is the case, and you can't predict with certainty. Part of the problem with public health, it's a game of percentages and human behavior. And so it's not as deterministic as people like, but likely we will see some more cases in Nebraska coming up in the next few weeks.
As this infection goes forward, as we talked earlier, you were kind of following what's going on in Texas. Maybe just talk a little bit about that situation in Texas and how it's now become a pretty serious situation, and what are the likelihoods that we can prevent a similar situation here in Nebraska?
Okay. So what happened in Texas, it was a community of Mennonites who did not vaccinate at high rates, a lot of homeschooling folks. So there was sort of a critical mass of people who were homeschooling, not vaccinated, things like that. Once it leaked into the community, then it spread pretty rapidly. Over the course, I think Texas is up to about 750 cases range, about 100 hospitalizations, unfortunately 2 children who died. And then that's where your percentages start kicking in. Your hospitalization rate is in the 10 to 20%. And for kids under 5, it's more than 20%. So the biggest risk is the young kids. I think I was reading about the Sonoma outbreak back in 2019. They had a huge number of kids between 6 and 11 months get measles because that's too early to vaccinate, or before most kids get vaccinated. And then 1 out of 150 kids died. So much higher rates of death in the younger kids. Now, since then, Texas, I think, has had a pretty good vaccination response rate, meaning I think it scared enough people that they started vaccinating. New Mexico actually published. So one thing we're missing in Nebraska is the detailed data. So in Texas, you can actually look up the vaccination rate of every single school district in Texas. And by doing that, which I've looked through them, you can kind of get a sense for who vaccinates and who doesn't based on the names of the schools and where they are. And then New Mexico actually also has been publishing how many measles vaccines have been given this year versus last, and they've seen a significant uptake in people getting vaccinated. So it'd be nice to look at our measles vaccine rates. If we're giving a lot more measles vaccines, then your rate's going to go up. And we could track that, for example, with our state immunization system. So it'd be good to have some of that extra data, but some of those states are producing some really cool dashboards so you can know exactly what's going on. Like Texas, you can see every county where there's an outbreak, which is important because, if I had a child between 6 and 12 months of age who hadn't been vaccinated, I would not travel in that area right now. And so it's really important for parents who have someone who's too little to get vaccinated. You can get vaccinated between 6 and 12 months, but there's some trade-offs there, especially before 9 months. But it's to the point where, my wife and I were talking, my wife's a physician too, if we had little kids below a year of age, we wouldn't be traveling to a lot of places right now. I'd be very cautious.
So is Nebraska set up to fight this and successfully beat this back, or how do we stack up?
I'd say it's mixed. The things we're missing, I wish we had better data than we have. I think we're getting better in the state. The state's been doing better about putting stuff on dashboards and releasing it, just like this report that Emily and we were able to obtain the same information, which was great. So that's good. But we could be doing better with sharing information back and forth between healthcare and public health and local health districts. The other problem right now is there were some very big cuts to public health where money was clawed back from the federal government, and a lot of health departments are downsizing right now. I literally had a meeting with somebody from a health department 2 days ago, and I just got an email saying that she was being downsized because their funding was cut. So So it's going to be harder to respond because of our cuts in public health funding and our staffing right now, couldn't come at a worse time. On the positive side, we did do some really good things. So like Governor Pillen held a press conference a few weeks back. He came out unequivocally and said, you should get vaccinated. And that's need people at the top just saying that direct, not dodging it like somebody else we might talk about later.
Yes.
And then also we've got some good people in place. So Dr. Sydney Stein, who was on that, gave her information was just spot on. So we've got an epidemiologist who definitely knows what she's talking about. We've got Tim Tesmer, our chief medical officer. Tim gave good information. And so having that clear, direct information coming down from our state government, that's great. It's hard to understate how important that, or overstate how important that is. And then Nebraskans have a way of sort of just doing things organically sometimes. So a lot of us have been just doing stuff just because, like, the medical community is very good about this. A lot of doctors I know are carrying the message to people, posting stuff on social media. I know Phil Boucher, who's a pediatrician in town, does a lot of social media. He's been posting a lot of it. And so there's a lot of stuff happening just because people step up and do the right thing, because that's, in my opinion, that's Nebraska for you.
Yeah.
So some of our good things,
We'll get to Mr. Kennedy here in a moment, but maybe this is a good point in the show, Bob, to talk about, because I know a lot of people are asking, I don't remember when I got my measles shot, as an adult, or as, what should we be thinking about and acting on as adults?
Yeah. Well, part of the problem is, again, the CDC is not coming out with very clear information on it. So we're having to turn to other sources. I listened to a podcast called TWIV, This Week in Virology, with Dan Griffin, where he goes through this. Now, he's my go-to source. Or your local epidemiologist, Dr. Kate Legenolita. They've been putting out some good information. So if you're born before like 1958, measles was pretty much spreading and people got it. So chances are you're immune. So if you're born pre-1958, I wouldn't worry about it at all, because likely you had it when you were a kid. Now between 58 and 68, that's another challenge, because for a while, one of the first measles vaccines wasn't as effective, especially if you're born between 63 and 67. And so that first shot you got might not have worked. And up until 1989, we didn't do a second shot. And we started doing a shot in 1989. Guess why? Because we had a measles outbreak. When I was at Creighton at the time, one of my college buddies actually got measles. And they said everybody should get their second shot. And that's when it happened. I didn't get my second shot at the time because my mom told me I had a febrile seizure when I had my first one. So I didn't get one. Now they've realized that's not a contraindication, but I know because of that I didn't have my second. Also, my wife, who's also in, that age range, she probably might have gotten the not so effective vaccine. So both of us did get our measles boosters here in the last few weeks, just to make sure. There's a couple approaches. If you're in that gray area, if you can't verify that you've had two vaccines, you can do one of two things. Just go get one, because it's not going to hurt anything. Or you can there's a blood test you can see to assess your immunity. You can do that too. So if you're kind of in that born between like about 1960 and 1969, I'd see what you can find out. Part of the problem is most people don't have their records, like unless their mom kept their baby book. And, actually I have a coworker and he was able to find it in his baby book.
Yeah, because it was that big of a deal. I kind of fall into that category just right after that anyway. So, well, let's move on to what's going on the national front, Dr. Bob, because I know that's of concern to a lot of people. And you mentioned the Samoan measles outbreak back in 2019, and people have said that if you really want to see what a continued drop in childhood vaccinations looks like, read about that Samoan measles outbreak, and where 5,700 cases, 83 deaths, in large part by information put out by Robert F. Kennedy Jr., who is now our Secretary of Health and Human Services. Just an unbelievable, in a good test case, right? Here's what happens when you mess around with science.
Mm-hmm. Yeah, it's sort of a tragic case because it started all because of an accident. So what happened is two kids died after getting vaccinated. And the problem is they weren't actually given just the vaccine. A nurse made a mistake and accidentally pulled medicine that was a paralytic agent and gave it to the kid as well. So it wasn't the vaccine that killed him. It was this accidental poisoning with a drug. But the anti-vax folks like RFK and people he knew claimed it was the vaccine and told them it was that. And it scared a lot of people, and they didn't vaccinate. And he actually literally traveled to Samoa to help promote this. in mid 2019 before it all went down. And so the vaccination rate for kids, I think under 1, dropped from about 74% to 34%, which is just nowhere close. Somebody with measles traveled to the country and it just spread like wildfire. They had to close everything down, literally cancel Christmas gatherings, everything to get this thing to a stop because they didn't have enough hospital care to take care of that many sick people hospitalized. And so the deaths may have been partly exacerbated because they ran out of medical care. And that's the problem, like we ran into a COVID. If you let it go too fast, when you run out of ventilators and nurses and hospital beds, more people die. And so it was a horrible outbreak. And they had to contain a couple islands. Oddly enough, right as COVID was starting to happen, one of my go-to people I used to talk to, had been mobilized. Ali Khan had been mobilized. I think he was on Tonga or one of the islands. And so he was actually part of trying to help tamp that all down. And I think it didn't get as much press as it should have been, probably because that's right when COVID was happening. So COVID sucked up all the oxygen around. And so nobody heard much about this Samoan outbreak. So here we have this horrible thing. You'd think that would scare people, but people didn't hear much about it because COVID was taking up all the press. So this kind of got swept under the rug. And even RFK's role was sort of not, people didn't pay attention. But if you go read the articles about it, he was part of making it happen, unfortunately. Yeah. And tries to dodge it when you ask him about it. And, unfortunately, there's some videos of him being asked where he kind of hems and haws. And it's like, no, he was part of it.
He was in the news. Well, he's in the news quite often here because of our concerns with truth and science and facts. But he was just in the news again this past week about the much anticipated study that he wanted to release, that he did release, Make America Healthy Again, which decried America's food supply, pesticides, prescription drugs. There's even pushback now from qualified real journalists, including the Associated Press, that the basis of the report isn't even based on facts. So anyway, I didn't know if you had any thoughts on that.
Yeah, the problem is it's a mishmash. There is some good stuff in there. There's accurate things. We do have problems with our food supply. We do have problems with our diet and lack of exercise. We actually do have so some of those things that they cite as causes are correct, but then they throw in lots of other things that are more in the conspiracy realm thing, for example. The other problem is they act like there's no research behind this. And actually, there's decades of research about what we need to do about it. The problem is it's hard to fix because there are political reasons why it's hard to fix. So sugar-sweetened beverages, I've been working on that for almost 20 years. The problem is when you try to do something about it, a very well-funded beverage industry doesn't like you and they fight back pretty naughty sometimes. So so some of the whole political thing is correct too. Yes, the food industry is part of fighting that, but some of their prescription is off quite a bit, actually. It ignores a lot of research. And now we've found out it sounds like they actually probably used AI or ChatGPT to write some of it, and it made up citations that actually don't exist. So obviously somebody didn't proofread it very well, so it's kind of comical. Well, it'd be comical if it wasn't someone in a pretty important post put it, but you think they would have been smart enough to at least check the citations, Just like some of these legal cases where a lazy lawyer has had ChatGPT write their brief and they forgot to check to make sure those were actual court cases and found out that they were made up by ChatGPT. And so it sounds like the same thing has happened with some of this report, maybe. It'll be interesting to see how this plays out.
Well, all the more reason why to have a strong and healthy system here in the States. If we can't rely on accurate, scientific, fact-based information from our federal government, then, we've got to localize it and make sure that we're doing our best to inform and educate citizens.
Yeah. And I'd say that's my bright spot. I don't think we can rely on the CDC anymore because they have good people there, but everything they say can be overruled or quashed, and it's already happening. There are things literally being censored, not being shared, data being cut off. So we can't rely on the CDC like we used to. So we're going to have to do it ourselves. And thankfully, Nebraska has a lot of good folks in Nebraska who do know some of this stuff. So there's some great resources at our College of Public Health. Like I said, Doctors Tesmer and Stein and our governor did a great press release on this. So we've got some good things going for us at least. So maybe we'll tamp ours down pretty quickly. Fingers crossed.
Yeah, fingers crossed. The last topic before I get you out of here, Bob, is let's talk about this loss of funding. And obviously, throughout the federal government, there's story after story after story in everything from weather balloons to our universities. But nearly $100 million in funding that's already been distributed to Nebraska is being clawed back according to a list of canceled grants published by the U.S. Department of Health and Human Services. It's part of an HHS overhaul that will cut nearly 20,000 employees, a quarter of the department's workforce, cancel billions of dollars worth of grants that have already been allocated around the country. I don't know how closely you've been following this, but has there been some impact here in Nebraska?
Yeah. I mean, and not to me directly, actually. So I work as a sub on a grant that's the Health Disparities Grant where I do the evaluation. It's in Omaha, and they've zeroed out all the immunization portion of the grant.
Really?
So right when we need vaccine promotion, the area this group working with the most underserved in Omaha just lost its funding to do any vaccine promotion. I've people I work with at health that I know and do stuff with health departments across the state just this week are losing their jobs. They couldn't come at a worse time. So that's a problem. And so heads aren't going to fund it. Well, the state's going to have to, but is the state going to? I don't know. What is our plan? So I guess we're going to have to figure out in the state how we're going to do a better job of working together with what we've got.
Well, and, I've said on this show several times, and I've actually challenged some of our congressional delegation. That's where that's where the responsibility needs to rise up now is our other branch of government of our legislators and Congress to step up and say, we're the ones who allocate these dollars, and they need to step up and do something. And so let's hope they do, because and again, we aren't talking about Doge and looking for places that there's always, I'm still a Republican, and I still believe in government being efficient. I think all of us, whether it's a government agency or a business, we should be responsible.
Yeah, well, that's also why I put my update. Now, I'm an independent, by the way. Yes, this is good governance, that managing measles, because measles outbreaks are really expensive. The estimates are $45,000 a case when you add up the public health, the contact tracing, the lost productivity, the hospitalizations, and then the kids who get permanent injuries. There's kids who go deaf with encephalitis. That's lifelong medical bills. And so it's cost efficient to vaccinate against measles because these outbreaks are incredibly expensive. When you start having polio and pertussis and all these things coming back, those are really expensive. One reason we do so much better economically than we did 200 years ago is we don't have all these sick people everywhere with smallpox and measles and polio and you name it. So this is a really bad financial decision to not vaccinate everybody.
Yeah. Dr. Bob, what have I missed? What would you like to chat about here as we wrap up here?
Well, if I could wave a magic wand, I'd have a state group that works on this, where it's a combination of both public and private. And so I'd love it if we had our, Doctors Tedesmer and Stein and our interim public health director got it together with those of us working on this at the local and state, and whether it's university health system. It'd be nice to put together, we could have a Make Nebraska Healthy initiative based on evidence and what people really know. That would be really cool.
Okay. We'll start that right here, Dr.
All right.
Bob. We'll light the fire and see if we can get it lit. So, Well, Dr. Bob Rauner, thank you for your voice. Thanks for taking a few minutes and coming on the pod, and continue to do the great work that you're doing, my friend. It's important. I know you know that. I know our audience knows that. And so thanks for your work. It's deeply appreciated.
All right, you're welcome.
Hey, thanks very much, Dr. Rauner, for taking time to update our audience on these important health issues, and for your continued good work. It's very much appreciated. And just moments after we finished our interview, this important update from Washington. Days after Health Secretary Robert F. Kennedy Jr. announced that COVID shots would be removed from the federal immunization schedule for children, just today, the Centers for Disease Control and Prevention issued updated advice that largely counters Mr. Kennedy's new policy. The agency will continue to offer COVID shots to children ages 6 months to 17 years under a shared decision-making model with a doctor or provider. This also applies to roughly 38 million low-income children through the Vaccines for Children program, according to a CDC update just this afternoon. So, some much-needed good news coming out of Washington today. Hey, thanks to the Parsons team who made this show possible. Chase Porter, executive producer, Ike Simonis, producer and graphic design, Penology, Tech Solutions, technical help and equipment, and Kim Remington, Parsons PR's director of operations. And thanks to each of you for your support. Hey, and if you're not following us on YouTube, hop on over there and hit the subscribe button and leave a comment. It's where all the cool kids are hanging out, so join us over there. That's today's show. Thanks for tuning in. Now go do good things. I'm Dan Parsons.